Hey. Good afternoon, ladies and gentlemen. My name is Rachael Madders, and I'm a Masters of Public Health candidate and keen novice public health researcher. I'm here today to discuss some of the research I was involved in, exploring climate resilient healthcare in Southeast Asia. This project was a joint collaboration working with my colleague, Dr. Connie, who is also in the audience today, and colleagues at Healthcare Without Harm, Southeast Asia region. I would just like to start by thanking Connie and my colleagues at Healthcare Without Harm for allowing me to be a part of this exciting project. So our research specifically focused on the Southeast Asia region, an area which we all know has been identified as one of the most susceptible to the effects of a changing climate. This is particularly highlighted in this picture I've got up here, which is from a hospital in Thailand after they experienced heavy flooding that required them to temporarily close and evacuate all patients in their care. This is just one of the many examples of climate disasters impacting essential healthcare services in Southeast Asia. By offering practical region-specific recommendations, we hoped to contribute to the ongoing efforts to mitigate the effects of climate change on healthcare infrastructure and services. So to gain a comprehensive understanding of the specific challenges, needs, and feasible indicators for progress towards climate resilience, we conducted in-depth interviews with members of the Global Green and Healthy Hospital Network in Southeast Asia. We also augmented this analysis with data drawn from some existing reports. So participants were based on a variety of contexts, including urban and rural settings, as well as low and middle income countries. Both private and public health systems and facilities were considered. So our research findings were collated and analysed under Healthcare Without Harm's key principles for building climate resilient healthcare, which are seen on the screen here. So we found, so just an example of some of our research, we found that Mary Johnson Hospital in the Philippines recognized its significant contribution to greenhouse gas emissions and aimed to mitigate this impact. So through collaboration with multiple stakeholders, a variety of strategies were implemented, including the repurposing of PPE and various other waste reduction products. So another more local example is the Sunway Medical Centre Velocity, just across the road here. They committed to the Race to Zero initiative, which was a global green and healthy hospital initiative, and they implemented a number of carbon reduction initiatives to promote sustainability and environmental health. So our interview findings highlighted various primary areas of focus, which encompassed disaster readiness, low carbon strategies, and financial aspects of climate resilience. A prevailing theme emerged, highlighting the importance of behaviour change along with staff education and training. So there was actually a couple of hospitals that provided training to its staff members on managing and treating diseases such as vector-borne diseases that we know are directly related to climate change. Our research highlighted the notion of health equity and its relationship with climate change, as well as the environmental, economic, and social disparities that are exuberated by climate change in Southeast Asia. Our interviewees also highlighted a number of challenges in implementing their initiatives, including finding a resistance to change, in particular from staff and hospital boards and directors, a lack of general public awareness, and financial concerns. So it's clear to see that we still have a long way to go to decarbonise healthcare. However, Southeast Asia is a shining example of how we can get started, and I think that many countries from around the world can learn from this. So we hope the findings of this study contribute to the broader understanding of how health services can be reorientated to face the realities of climate change effectively. This research outlines tangible recommendations for health services from both a process and impact point of view and offers valuable insights for healthcare providers and researchers in the fields. So we have our poster outside if you want to have a look at some more examples, but thank you for listening.